Now, as the pandemic drags on, concerns about mental health continue to grow, especially in the classroom. That's why several students tested in favor today of a Senate bill that would help identify and address mental health issues among students. This bill would establish a pilot program starting this summer to create screenings in some high schools. Fox 12's Audrey Wheel joins us now live with what these students are saying and how exactly this bill would work.
Bonnie, the idea is to address anxiety, depression, suicide, mental health issues that students have already been facing, now even more at the forefront with the pandemic. And students we heard from today say that these screenings would provide easy access at an important age to get the help they might need.
It's very important to me to get students the help that they need.
Gabby Cohen is a sophomore at Sunset High School and part of a group called Students for a Healthy Oregon, which is pushing for mental health screenings at high schools. Senate Bill 782 would have the Oregon Department of Education establish a pilot program to do just that, with at least 10 school districts in partnership with local mental health providers, screening for things like anxiety or depression.
Ideally, and this is how we've seen some of these pilots work before, we train people in how to give this very simple, paper and pencil screener and how to assess, add up the numbers. And if you see a number that says X or above, you've got a primary care clinic that you can call and say, hey, I've got someone who's looking like this, and this is what I'm thinking. What do we do next?
For Cohen, this is a passion born from personal experience.
When I was in the 4th grade, I didn't know what mental health was. And then my mom had unexpectedly taken her own life. And that was something that I was not aware of. Nobody in my family was aware of her depression. I have a twin brother who is on the spectrum and has some anxiety. And if it weren't for those issues being identified early on, I don't know where we would be with that either.
She says being able to screen students at school offers equal opportunity to identify and help with any issues.
Obviously, my mom was not a student, but if she were and she were to get screened, then we could have prevented this.
And she and the chief executive of Behavioral Health for Providence, Dr. Robin Henderson, say now is the time to start, with student mental health at the forefront during the pandemic and kids returning to the classroom after a crazy year.
We're very comfortable doing vision screenings and hearing screenings and even that whole thing that you do for spine screenings for scoliosis and stuff like that. Here's what we know. 75% of all mental health conditions start between the age of 14 and 24. So why aren't we looking at screening that population where they are in schools?
And again, today was just a public hearing on the bill. The Committee on Education will discuss that further on Monday. Now, if you or anyone you know is struggling right now and needs someone to talk to, we do have a list of resources on our website. Just head to kptv.com/bettertogether. Reporting live in Northwest Portland, Audrey Wheel, Fox 12 Oregon.